That's great. Thank you very much, Fern. We're really happy to be here. We like to think of ourselves as a success story, so we're really grateful for the opportunity to talk about Easyride with you. Easyride is what we now call the program which developed from the HSIP, Aging at Home HSIP. It was initially called the Rural Transportation Coordination Project in Huron-Perth. And we are very thankful to the Southwest LHIN for the funding that was provided to us to go down this path. We're part of the Aging at Home strategy. Our funding in 08-09 was $109,000 base, and the one-time funding of $137,000. 9-10 year, just over $228,000, and our current year that we're in right now, we're still waiting for the final confirmation, but it will be approximately $238,000. And certainly we could not have accomplished what we have accomplished without this funding, and that's something that we make very clear to other LHINs and to other agencies as we've been sharing our experience actually across the province. We have partner agencies. Stratford Meals on Wheels and AVI Services is the lead, but we also have all of the partner agencies across Huron-Perth who have been involved in transportation services over the years. So these are all the agencies that receive CSS funding for transportation, including community outreach in Milverton, Midwestern Adult Day Services, Mitchell and Area Community Outreach, St. Mary's and Area Home Support Services, Town and Country Support Services, and BON Perth Huron, which is the provider in the North Perth area. Collectively, we have been very fortunate with our vehicles. We have collectively 25 agency-owned and operated vehicles, 8 wheelchair-accessible buses, 9 full-size wheelchair-accessible vans, 5 wheelchair-accessible low-floor converted vans, and 3 7-passenger minivans. As well, we have 200 volunteers across our geography who are doing volunteer driving. This past year, we served 3,350 different clients, and 65,000 trips were delivered in the past fiscal year. So the purpose of coming together was really to create a system for community support transportation. And I know our partners, they're all very tired of me talking about system, but we need to develop a system for community support. We're the least understood, the least well-recognized sector in health services, and we really need to come together and kind of get our act together and create something that can be recognized by other sectors and by the general population. So why are we doing this project? It's the right thing to do for our clients. We're improving access. By coordinating, again, we're creating a system. By coming together, we are freeing local agency staff to do other services, or else they have the opportunity to reinvest dollars in direct service delivery rather than the coordination function. We are able to reduce client and other agency confusion over who to call. People need transportation, they don't know how to reach it, they don't know who it is they should be calling. We're also able to increase the potential for shared rides, which in turn increases the capacity across our geography. We're able to expand and enhance their existing services and reduce any duplication in services. So these are all kind of ideas why we came together in the first place, what we were trying to do. Our target population, we're looking at transportation for clients who are seniors, as well as clients who are without transportation or live in an area where there is no public transportation. They might have physical or cognitive limitations. They might require accessible vehicles, and they may not have family or friends who are able to take them when and where they need to go. Client success access service at the local community level, and our services are all local. But by teaming up and sharing our vehicles and our drivers, then we're able to offer flexible door-to-door service. One number gets service for anybody living across Huron-Perth. We have a local number, which is a Stratford number, and then we also have a toll-free number, which is accessible across the geography. So we address the following needs in service, and as I mentioned, easy access for clients. And in particular, it's easy access for hospitals, for CCACs, and for our long-term care homes. It's one number to call. It's affordable and accessible for everyone. We're able to increase the efficiencies, and I think we, as far as the LHIN's direction, we're able to help clients get to specialized hospital services across the LHIN, and these services are often not within Huron-Perth. They might be, in London or in Kitchener or in other areas. We're helping to achieve an integrated health system of care. So we're focusing on seniors and adults who are living in the community with complex needs, looking at servicing individuals who are either at risk of or living with chronic disease, and as well clients who have mental health and addiction challenges. We're helping achieve the Southwest LHIN system goal by increasing attention on promoting healthy living, increased access to transportation for medical trips, for appointments, for adult day services, community programs, shopping and errands, all the things that people need to get to remain living independently in the community. We're providing equitable access to services, and by building the foundation and the structure that's needed to go forward, we will be able to meet future transportation needs. We're also looking at the integration of healthcare delivery by applying a centrally coordinated resource capacity delivery approach. So we have a central booking office for all community support service transportation across Huron-Perth. We purchased a scheduling software program, and it's available at the local offices as well as centrally. We're optimizing our resources to ensure that all of our clients have transportation to medical appointments in particular, and we're making better use of local agency time, which allows reinvestment of these dollars into direct service delivery. Also looking at improving the efficiency and effectiveness of care and service delivery and maximizing human, financial, and physical resources across Huron-Perth. So our solution, and it was a journey to get to this point in time. We've invested a huge quantity of staff time, and we had a consultant kind of help us figure out what it is we need to do. And that process took, from the time that originally funding was approved, took about 8 months to get to that point in time. But we have our solution, and we've given it a name, and I think it's a really important thing that we did that, because Easyride is getting a lot of local recognition across our geography as transportation. If you need transportation, call Easyride and they will help you. So Melanie's just going to talk a little bit more about the Easyride service.